For a long time, restless and inattentive children were considered to be the result of poor parenting, lack of spanking, or even a sign of low intelligence. But with advances in medical research, especially in the field of mental health, researchers have come to the conclusion that there is a disorder affecting a portion of the population that causes certain attitudes. Attention deficit hyperactivity disorder, popularly known as ADHD, has changed the way society views certain behaviors. To some extent, the diagnosis represents a relief for misunderstood children and helps parents and teachers understand how to treat those with the disorder. However, in the hands of the profit-hungry pharmaceutical industry, this discovery has become one of the most lucrative businesses of recent decades. With aggressive campaigns and even the help of celebrities and social networks, ADHD has become the fashionable disease among children and young people, as well as adults. Today, even without a diagnosis, the disorder is used as a justification for forgetfulness and common mistakes made for whatever reason. But how has ADHD gone from an unknown disorder to a fashionable disease? What role has the pharmaceutical industry played in popularizing ADHD? If you want to know the answers, stay tuned, because today we're going to talk about that and much more, starting with the shady strategies of Big Pharma. In an interview in the 1970s, Henry Gadsden, then CEO of Merck & Company, stated that his company had a serious problem. According to the executive, the company's big dilemma was that, by treating its customers' diseases, it was shrinking its market. The solution, he said, was to be able to sell drugs to healthy people and get them to consume them as if they were chewing gum, and moreover, indispensable for modern life. Perhaps at the time, the statement was no more than an executive's vision. However, in the following decade, a series of events enabled the laboratories to turn the claim into profits. In the 1970s, a study by American psychologist David Rosenhan cast serious doubt on the ability of psychiatric tests. In his paper, entitled "On Being Sane in Insane Places," the psychologist and 7 other volunteers went to various psychiatric hospitals in the United States and claimed to hear voices repeating the words hit, empty, and hollow. This was enough for all of them to be admitted, and, after entering the hospitals, although their behavior was normal, and they told the doctors that they were feeling better, they remained in the hospital for several days. The author of the experiment himself was hospitalized for 52 days. The publication of the results shocked the medical society of the time and prompted a psychiatric hospital to propose a challenge to the psychologist, which led to a second phase of the study. In this new stage, the psychologist was challenged to send pseudo-patients to the hospital, who were to be identified by the doctors. In the following weeks, the hospital's medical team claimed to have identified 41 people who had been sent by the psychologist and who had not been admitted. Following this revelation, Rosenhan reported that he had not referred any patients, further undermining the credibility of psychiatric hospital evaluation systems. Although controversial and highly contested, the experiments conducted by David Rosenhan raised many doubts about the ability of physicians to identify mental disorders and brought about change. The major response came in 1980, when the American Psychiatric Association published the 3rd edition of the Diagnostic and Statistical Manual of Mental Disorders, which became known by the acronym DSM-3. The manual, written by psychiatrist Robert Spitzer and his team, introduced 265 diagnostic categories and completely changed mental health theory and practice. Professionals now had extensive research material at their disposal and could base their diagnoses on the criteria presented in the manual for each disorder. A truly powerful material, which in the hands of professionals can be of great use, but in the hands of a greedy industry can be a powerful treasure. How did the pharmaceutical companies take advantage of this manual and create the ADHD fever? The main advantage of cataloging disorders was to standardize diagnosis. After the release of DSM-3, doctors began to speak the same language. This gave patients the feeling that their problems were not something supernatural and could be treated in many cases. For pharmaceutical companies, it became a roadmap for developing new drugs and creating a huge new customer base. The first drug to experience a jump in sales after the launch of DSM-3 was Prozac, the trade name for the substance fluoxetine, which began to be prescribed for various brain-related ailments from the 1980s onwards. Pfizer was quick to enter the market, and in 1991 launched the antidepressant Lustral, also known as sertraline. At the time of the launch, the company's then CEO, Bill Steer, stated that his main goal was to bring marketing and research closer together, which was evident in the company's subsequent moves. After analyzing the market and discovering that about 75% of prescriptions for depression drugs were being written by primary care physicians rather than specialists, Pfizer put its team in place to take advantage of the situation. The company hired Robert Spitzer, who had led the creation of DSM-3, to develop a rapid diagnostic test for depression. Since doctors are used to dealing with parameters such as blood sugar levels and the like, the test called PHQ-9, applied within minutes, could determine whether or not the patient had depression and the degree of the illness. The test became a benchmark, and Pfizer achieved the feat of determining who should take its drugs and who should not. But there was still a lot of market to be created. When the fourth version of the DSM was published in 1994, it included the 4 letters that became a new multi-billion-dollar market and brought millions of customers to pharmaceutical companies. ADHD, or Attention Deficit Hyperactivity Disorder, had long been studied, albeit under different names. According to researchers, the first description that matches modern concepts of ADHD occurred in 1798 by Scottish physician Sir Alexander Crichton. Since then, many researchers have dealt with the subject, and around 1960, a duo formed by child psychiatrist Leon Eisenberg and psychologist Keith Connors began to study the use of certain drugs to treat the disorder. The study published in 1963 showed that the drug Ritalin could help so-called disturbed children improve their behavior. Beginning in the 1960s, methylphenidate, the active ingredient in Ritalin, began to be used increasingly as a treatment for youth and children with ADHD symptoms. However, according to the available data, until the early 1990s the diagnosis was rare, something that changed completely with the turn of the century. In fact, the term ADHD was introduced in the second version of the DSM, which was published in 1968. However, it was not until version 4, in 1994, that the current concepts of the disorder became clear, marking a milestone in the rise of diagnoses. Only 1 year after the publication of the manual, about 500,000 children were diagnosed with ADHD in the United States, a figure that increased not only in that country, but worldwide. Faced with a new market, with millions of new potential customers, the pharmaceutical companies began to use their usual procedures, which we already saw in the video on how they act in a similar way to mafia organizations. In the 1990s, the leading authority on child psychiatry was Dr. Joseph Biederman. As head of the research department in the areas of child psychopharmacology and adult ADHD at Massachusetts General Hospital, linked to the renowned Harvard University, one would think that his opinion would be one of the most relevant on the subject, and so it was. His numerous studies have served to support the prescription of medication for the treatment of both ADHD and bipolar disorder in children as young as 2 years old. According to a report in the New York Times, Dr. Biederman's work contributed to a 40-fold increase in the diagnosis of pediatric bipolar disorder between 1994 and 2003, and a rapid increase in the use of powerful, risky, and expensive antipsychotics in children. The credibility of the doctor and his studies was seriously undermined when an investigation by the U.S. Congress in 2008 uncovered his ties to the major pharmaceutical companies that manufactured the drugs he recommended. Among several documents uncovered by the investigation were emails from the doctor pressuring some companies to release funds, and also internal correspondence from the companies, in which executives mentioned that not complying with Dr. Joseph Biederman's demands could be detrimental to business. While the reputed physician's studies and recommendations were used to convince other professionals to diagnose ADHD and prescribe medication, drug manufacturers invested a fortune in communicating directly with parents. In various campaigns in high-circulation magazines, advertisements showed parents that, with the right medication, their children could achieve grades commensurate with their intelligence. With so much publicity, the demand for ADHD diagnoses increased exponentially, as did the positive results. The percentage of children and young people diagnosed with this disorder rose from 6.1% in 1997 to 10.2% in just 20 years. These figures have caused even Dr. Connors, the driving force behind the treatment, to question the excessive number of diagnoses. In 2012, he dismissed the figures as absurd and said that the diagnoses were an invention to justify the distribution of drugs at unprecedented and unjustifiable levels. If we analyze how many drugs have been sold, the argument gains even more force. Sales went from 1.7 billion at the turn of the century to nearly 9 billion in 2012. In addition to Dr. Keith Connors, other experts are concerned about the rising number of ADHD diagnoses. American psychiatrist Alan Francis, who was one of the researchers involved in the development of DSM-3, issued an important warning in an article published by the BBC. The doctor states that many diagnoses are made by inexperienced professionals in just 20 minutes. In another part of the report, he says that it is now normal to be medicated, and not the exception, stating that this type of medication is essential for only 5% of people, and that it is absolutely harmful when used incorrectly. For the disorder to be correctly diagnosed, several sessions and a thorough analysis of various factors in the patient's life are necessary, especially when it comes to children. Alan Francis himself wrote in an article on the psychologytoday.com website that the assessment should take weeks or even months, because children can change so much from one session to the next. However, with all the visibility the issue has gained, many parents are convinced by teachers that their children have the disorder and go to doctors just to get the diagnosis confirmed. When they do not get it from the first professional, it is common for these parents to keep looking until they find a professional who confirms the diagnosis and prescribes medication. Not to mention the proliferation of online tests, in which it is enough to answer a few questions to receive a diagnosis. And although these tests have no scientific or medical value, they serve to increase the number of people who claim to have the disorder and make ADHD even more visible as a fashionable disease. And the industry still had, and has, plenty of room to grow. While the market for children's drugs was promising, pharmaceutical companies realized that if they could reach adult audiences, they could make a lot more money. The doors to reach this audience began to open in 2008, when American TV star Ty Pennington gave a testimony about his life as an ADHD sufferer, and how the drug Adderall had literally transformed him. So far so normal, but what was later discovered was that he had been hired by the Shire Laboratory, manufacturer of the drug, to be a sort of poster boy for the company, and publicize the importance of the diagnosis and medication. The same strategy was repeated years later, this time with Maroon 5 member Adam Levine. In this case, the contract was indirect, as the singer partnered with an organization funded by the lab. The popularity of ADHD has been boosted by the emergence of social networks and profiles dedicated to showing the life of a sufferer, who in many cases does not even have a diagnosis confirmed by a specialist. With so much exposure, ADHD has become a fashionable disease. Online tests to identify the disease have proliferated, and it has become an excuse for forgetfulness, inattention, and other routine problems that have nothing to do with the disorder. At no time is this video intended to deny the existence of the disorder, nor to discourage people from seeking medical help. Our goal is simply to demonstrate that the pharmaceutical industry has worked and is working to convince healthy people that they are sick in order to sell more drugs. The diagnosis of attention deficit hyperactivity disorder divides even the scientific community, since there are no physical tests that can prove it. But, as we have seen, the disorder cannot be identified in a quick analysis that does not take into account the patient's environment and other factors. To better understand how pharmaceutical companies are more like mafia organizations, just watch this video here on the screen. Just click on it. Thanks to all of you who have accompanied us this far. Hugs, and until the next video.